Hi, everyone. Welcome to another Mission CISD House Calls with Dr. Darryl Stinson joining us once again. Welcome, welcome.
Thank you.
We're going to be talking a little bit about something that's probably on a lot of folks' minds this time of year because everything is in bloom and 'tis the season for sneezing and watery eyes and itchy eyes and runny noses and yeah, allergy season because everything's in bloom right now. And I'm assuming you've probably started to see an uptick of people coming in.
Definitely.
Um, with allergy season, it's sort of like, okay, where do we start on this whole conversation? Um,
Well, I think one of the things you probably want to say is how do you know is what's the difference with the allergy or a cold?
yeah,
Because we're still at the end of cold season, and uh, and that's a very common question I get at the clinic. Is this an allergy? Is this a cold? They're pretty much impossible to tell apart most of the time. You can get fever with allergies. So a lot of people don't understand that.
uh-huh.
So you can't. But for the most part, yeah, fever is going to be more of an infection. So the symptoms are very similar. You're going to have congestion. You have increased blood flow to your upper airways. That's why you get that swelling, that congestion, that drainage, and the coming either back in the throat, making you cough, uncomfortable, swelling in your throat. Your voice gets raspy, or you lose it. The ears will get stuffy, or you can't hear, or they'll hurt,
Hmm.
and you, it's uncomfortable, and it goes on for a long time. Now, the people who have severe allergies, they know what to do. I mean, it's so bad they actually get help, and it's worked on, and we have a good strategy for them. But for the most people don't have that severe allergy. They have the mild to moderate, and they're the ones that have the most problems because it doesn't happen to them enough or hard enough, and so they'll let it dwell. They'll let it carry on for longer than I think they need to, and they just don't have the right strategy compared to the people who have really bad allergies.
Well, what kind of strategy should people be keeping in mind?
So one thing is, if you're one that has, like, always this time of the year, I get watery eyes or itchy nose, I get congestion, or I sneeze a lot, or I have this, then you need, okay, well, then let's treat you for the season. And the season isn't just a couple of days. And which I see a lot of people, they'll take their allergy pill, one day, and then they won't take it for another week, and then they get. So no, you have to be consistent. You have to really, allergies going to be, season's going to be here. Do a 90-day plan. So get your antihistamine for 90 days. Do your, rinse out your nose with a little saline solution, the stuff you get over the counter, just like salt water, just saline solution. Rinse it out a couple times a day. Get all that pollen and dust out of your airways, all the receptors in the front part of your nose. So wash them back. Just rinse it out. Um, the I really recommend people use the cortisone sprays for their nose, which is the Flonase, and now they're over the counter.
I was going to say it's over the counter
It's over
now,
the
so you
counter.
don't need a prescription for that.
Exactly. It's a diluted form of it, but it works just as well. Just do it twice a day instead of once a day. So you want to do it. It's cortisone. Pretty much when you get a rash, people have rashes and recurrent rashes. They don't put the cortisone on there one time, and then let the rash hang around. No, you put it on there until the rash is gone. Same thing with the allergy. You want to use that cortisone nasal spray for usually at least 30 days before the swelling goes down. Uh, and that's for people who don't take care of it. Now, if you've been taking care of your allergy, as soon as it comes on, you take your antihistamine, you rinse out your nose. You could probably do the nasal spray for about 30 days, and that's all you need. But I typically like people to do it like the whole 90 days because whatever's around is going to be around, and it's going to be in your house. And that pollen, yeah, maybe the trees stop pollinating, but it's still in your house. It's still in your air ducts. It's still around the ground, and so it's still going to be hanging around a little bit. So I think the biggest problem is people not treating long enough, not nearly long enough. Again, a couple of days or a few days, not long enough, and then not using the cortisone nasal spray to help get rid of all that swelling, and which will stop your sneezing. It'll stop you from having the ear pain, and it's just the like the best strategy for getting rid of your allergy symptoms, and you'll be fine. You'll have them for a few days, and then you start doing that. Continue the 90 days, and you won't be suffering for weeks and weeks and weeks.
Now, if I know I've got seasonal allergies, whether it's the spring season or fall season or whatever, does that mean when that season hits, I should be locking myself up inside and closing all the windows and doing all of that? Or does that impact really whether or not you are bothered by allergies?
Yeah, you still have to breathe the air coming in from outside. It's still coming into your house. So you're going to get, you can't really seal your house from the allergens. It's going to be in your house. Most people have allergens that are the common in the dust, and that it's out there. Most people have just allergies to that. And so they're going to be year round having problems. Just the people with the pollen allergies, the when you see it coming, yeah, close your windows down. You, we always tell people that have children with a lot of allergies, we said, look, minimize carpets in their bedroom. Don't have carpets around as much. A lot less bookshelves. You don't want shelves stuff because the dust accumulates, and you as they're moving around the house, it stirs it up, and they inhale it. They get the allergens, the little particles in their nose, and your body reacts to it and starts causing the reaction. One of the things also, if on your bed, we have a mattress and a pillow that just stores stuff forever. I think there's something I read where you have to really replace your mattress every 5 to 10 years, and it weighs so much more after that. And that's all our skin cells, but also just dust and pollen is in there. And so every time you go into bed, you're all that stuff is coming up, and your pillow. So the pillow, same thing. It may have you have your cloth pillowcase. That's such just right in there. So as soon as you put your head down on the bed, it's just all this pollen just comes right back out. That's why a lot of people they have a hard time sleeping, or they wake up very congested. They feel worse in the morning. They're sneezing all the time. They get up in the morning, they're just draining a lot. Well, because they've been sleeping on top of a pillow full of dust. And so those people that have those kind of allergies, I suggest you go buy a plastic cover that is special plastic covers for the mattress and special plastic cover for your pillow. Of course, you put your sheets over that and your pillowcase over that. And it really, really helps a lot of, especially the kids with a lot of allergies. So that's one strategy. But yeah, it's really not much you can do as far as keeping the stuff out of your house and keeping avoiding it. It's just environmental. Now, and people have very severe allergies. There's and the medicine just isn't enough. It just well, then we do have doctors that specialize in allergies, and they do the testing. I think more primary care doctors are going to start doing testing in the future as we get technology gets better. But for right now, it's best to go with an allergist and have them do the skin testing, and they actually do like an immunization. They kind of immunize you to the pollens, and it's a long term uh, treatment plan. Takes months and months of going and exposing yourself to that allergy, uh, whatever it is, whether it be pollen or dust, uh, and you kind of develop an immunity towards it, and so that's a good strategy. It really helps out, but for most people, just do what I was telling you as far as you know getting treat yourself when during the season when the season's here. Do a few little precautions on the allergens.
Yeah. Take those precautions to minimize the dust and allergens. Arm yourself with your nasal sprays and your antihistamines and your
Over-the-counter
nose
stuff, yeah.
wash, all the over-counter stuff. Yeah, because you don't have to have a prescription for a lot of these
Exactly.
things anymore. So that saves a little bit of money at least too. In your mind, how would I know whether or not I need to be going to see you or my own family physician or whoever, um, in terms of okay, is it allergy or not? When should someone make sure they get in to see their doctor?
Well, I during cough and cold season, during when I think when we're assuming it's going to be a cold, I always tell my patients, look, you're the doctor for the first 7 days. You take care of yourself. You take Hydrate yourself, take something for the pain, take some Tylenol or Advil for the sore throat or the pain. Uh, you can use definitely use the Flonase nasal spray. We now use it for common colds. It will reduce the amount of days you're sick with a common cold with coronavirus. It'll reduce Flonase, and we've discovered that. You don't need to go to the doctor for the first, I say, 7 days, unless you start having wheezing or some pulmonary. But just this here above, doctors ain't we're not going to help you. We'll you go to a clinic that may throw some antibiotics inappropriately because these are viruses, but then it isn't going to help. So, and the reason I say it's 7 days is because most of these things are going to be gone within 3 to 5 days. That's the how long they last. Uh, and so if something's still around after 7 days, then okay, I want to take a look at it. I want to see what's going on here. And if it's an allergy, well then okay, well, this is an allergy, and I'll help you with that. Or is it are you having a much more serious infection going on? Is there another germ that came in and took the opportunity while you were weak? And we call that opportunistic infection. Those tend to be a little bit more aggressive. Those tend to be we call bacterias, which we can throw antibiotics at it and help. But if you know it's just your allergies, you know what's going on, yeah, you can just take care of it yourself. And again, only if you have uh, really year long, you've tried everything, it's not working, then go see your primary care doctor. If it's beyond where I think this is just too much, you're just having too many, you're coming in here all the time, then I will send you to the specialist.
Yeah. Of course, anytime a fever's involved, I'm guessing then, yeah, we need to think about, okay, this may not be an allergy necessarily. Go see a doctor.
Well, like I said, even if it's a fever involved, even if I think it's a cold, like a viral infection, you still, there's not much I'm going to be able to do for you.
That's true.
And again, I say always try to avoid us. Just avoid the clinics. If it's just a little fever, don't worry about it. That's normal. You're having all the symptoms, that's okay. You can wait it out about 7 days. Um, Again, but if you know it's the allergies and it's just overwhelming, hey, come see me. I'll go see your doctor. We, uh, we definitely don't want you to be suffering without any help.
Very good. Anything allergy related that we haven't really touched on?
Well, there- that's yes, there's a lot, but I think the upper respiratory the rhinitis they call it, the
Yes.
nose, and they call it the rhinitis. It's because the nose is the rhino term, and that's the most common one. That's the one where everything happens. Most people get it, but you do get skin allergies, and so that in kids you're going to see the kids that have the allergies, and it's going to be on their folds here, on their arms, on their legs. Those are allergies themselves. A lot of asthma is kind of like allergy related. So if so you have the same strategy for both those. Of course, asthma, you're going to be treating the airways with inhalers and bronchial dilators, but you're still going to use cortisone. Like we use in the nose, they use cortisone for the inhaling. And for the skin, when you get the allergies present themselves as a skin, definitely. So that's what you want to do. Same strategy for allergens, and again, dust and stuff. They can react. Um, and on those, you put your topicals. You don't have to go to the doctor to get a cortisone cream. We'll prescribe a stronger cortisone, but you can get the regular cortisone over the counter, that 1% hydrocortisone, and just apply it 4 times a day, and that equals the type of stuff I'll prescribe. So that's one little hint that when you've got skin allergies, skin eruptions, and you want something stronger, you have it there at the Walmart, HEB. Just go pick it up and just apply it more often.
It's true. I never really thought about, yeah, seasonal allergies can affect you on the skin as well. So yeah, very good. Well, there you kind of have a few thoughts and when it comes to the allergy season, especially the springtime allergy season that we're going through. I'm sure we'll be touching bases on this again as some of it changes as well. And until our next time, we'll come up with another subject or two and be back with house calls before you know it.